Welcome to Healthcare du Jour, where we dish up and digest the latest in healthcare. For the next 30 minutes, sit back as we bring you insight, commentary, and discussion on trending topics to the table, all expertly served up by our host and his guests. Healthcare du Jour is brought to you by Carium, the telehealth platform enabling healthcare's digital transformation, helping you care for people within the fabric of their daily lives. Now here's your host, Matt Fisher.
Welcome back, and thank you for joining as we dive into the hottest topics in healthcare. I'm your host, Matt Fisher. On the menu today is Frank Forte, Chief Executive Officer at Anatomy IT. Frank, welcome to the show.
Thank you, Matt. Great to be here.
So, Frank, what I always like to do before getting into the main part of the conversation is to give my guests a chance to provide more of an introduction in terms of who they are and what they do. So, Frank, the floor is yours.
Okay, great. Well, let me start professionally. So, Frank Forte, I'm the CEO of Anatomy IT. So Anatomy IT is a healthcare cyber and intelligent transformation company, really focused on the mid-market providers, really across all care settings. So pre-acute to post-acute, including specialties, dermatology, dental, orthopedics, obviously acute care hospitals, post-acute, long-term care, senior living, et cetera. So we've developed a lot of specialties across the care continuum. I've spent 20 years in healthcare working for, I'll call them category leaders in technology, patient experience, rev cycle, and now IT. Personally, I'm an engineer by training, so I have a passion for looking for problems that are in need of a solution and building things. So my wife likes to offer my help to all the neighbors and help them with projects, fix and build things. So now I do that in the office as well. I have the privilege, Matt, of leading an incredible team of professionals at Anatomy that are dedicated to building a great company with a great mission of improving patient care through technology and intelligent transformation or digital transformation.
That sounds great. And Frank, you just said that you've been in healthcare, I think you said for around 20 years.
Yes.
So what got you into healthcare in the first place?
Well, like many things, it wasn't my plan. So opportunity knocked. It goes back to earlier in my career, I worked for a division of Emerson Electric Corporation. And so they were primarily focused on, industrial manufacturing. They had a hospital division, or I should say a healthcare division. And in that division, they were using primarily storage devices in healthcare. So it's supply chain devices, workstation for nurses and clinicians. And that quickly moved into more technology, right? Nurses were using these workstations for clinical charting and getting into the EMR. Medicine was not just being stored, but it was automated, med dispensing units. So the business morphed into more technology products for healthcare. The CEO of that division was a big fan of ethnographic research, which is a fancy way of saying get out into the field, talk to people that are using the equipment and devices, listen, learn, and most importantly, observe. And so I got a chance to spend a lot of time on the patient floors. That's the manufacturing talk. The patient floors, working with nurses, clinicians, and physicians. And a few things really stood out to me. First, look, the very big role caregivers, particularly nurses, play in patient experience. It just can't be overstated. Two, the tremendous impact technology could have on workflow. Like clinical charting, automating care plans, medication management, even medical supply fulfillment or supply chain. I mean, only through technology can you really get the efficiencies. And it was amazing the opportunity for technology in healthcare at that time. But ironically, and third, the enormous challenge was really around getting clinicians to adopt the new technology, particularly if it all altered their workflow. And most often, particularly then, it did alter their workflow. So adoption was really the biggest challenge. So those are really the three observations I had. But I credit it to one of my first jobs out of college, working for somebody who was passionate about healthcare.
It's a very interesting observation that you made that, the adoption of technology has, been a consistent issue. So, how have you seen that evolve, or, how did you kind of internalize those early lessons you were talking about and use that to come up with your process or, your philosophy when it came to encouraging the utilization of technology as it's become certainly more ubiquitous across healthcare?
Yeah, it's a great question. I think when I first thought of IT, what came to mind was help desk. That's what I first thought. And that's probably what most people think of, maybe even today. And the other thing they would think about are the components, networks, routers, cables, hardware, really everything in the basement or in the closet. And so nobody's really thinking about all the proactive things that IT really does. And I would say in general, IT was really not well received at all. In fact, it was considered a threat to patient care, a time waster. It's definitely a cost center. And physicians and nurses just really hated it because it meant change and required new workflows, training, et cetera. I would say where I really saw adoption start to take off was probably because of external drivers like the high tech, Affordable Care Act, meaningful use. This really was the first wave that drove adoption, particularly with the medical records. And that drove a lot of interoperability and other technologies associated with it. The next big wave was cybersecurity, or unfortunately, the cybersecurity attacks really drove security and compliance requirements. And then, of course, COVID drove a whole new other wave of adoption in terms of accessing technologies from home, mobile devices, et cetera. And then I think we're on the cusp of another one, which is around artificial intelligence and generative AI. So I've seen a lot of changes. I think the big thing when I think about IT is, and cybersecurity, we think a lot, or the company thinks a lot about getting it operationalized and rooted within the healthcare system. And we think about things that people don't ordinarily think about. We think about change management. We think about training. We think about even patient adoption, right? And those are the things that often, particularly technology vendors, don't seem to talk about. They wait till, they think the technology is going to solve the problems, but in fact, it's the opposite. You have to start with those things to get the technology even utilized. The technology can do great things, but only if the stakeholders embrace it and use it.
And that's a great point that you just made, which is kind of identify and quantify those problems and then figure out how you can, it sounds like, frame the technology and implement the technology to actually begin addressing the problem, as opposed to suggesting technology and then having it search out a problem that it could solve.
That's right.
So kind of the other thing that you did is you were framing, and I don't know if this was intentional or not, but you're talking about intelligent transformation. And I didn't know if that was just a different way of referring to IT, or kind of what do you actually mean by intelligent transformation?
I was waiting for you to pick up on that. So I often replaced IT with the terms intelligent transformation. I do it a lot internally just to signal to the team the shift that we're making in the paradigm, or the shift in the paradigm. And it also signals what's happening in the industry. So at one point, IT was a necessary evil, as we talked about. I think it definitely wasn't embraced, certainly not adopted at the pace that it needed to be. But now I think we'd all agree that IT, digital transformation, whatever terms you want to use, sits firmly at the intersection of the patient, providers, and the payers. It's really a strategic asset, or it's become a strategic asset to solve big problems. So workflow automation can drive productivity and address labor shortages. Healthcare talent is very, very hard to come by and retain. Cybersecurity solutions, preventative solutions certainly address a lot of the security and compliance requirements that are so important today. Telehealth, is a big game changer that drives continuity and continuum of care. Standardization across all the facilities, right? It's not just inpatient, it's outpatient, it's ambulatory environments, it's a home environment, it's mobile. So this standardization ultimately will drive more adoption, utilization, but also lower the cost. And then you have things like AI really helping clinical diagnosis processes, and even revenue cycle for that matter. There's a lot of technology poured into revenue cycle to maximize reimbursements. And so these are all strategic assets, right? These are things that need to be discussed at the boardroom, being sponsored by an executive. These are not things that come after the fact anymore. And I think, healthcare has really embraced that at this point and recognizes how transformative, intelligent transformation can really be for the organization.
And you just mentioned, probably almost every potential area of operation within an organization that, there's a technology solution for, or that technology could impact. So from your perspective, how do you prioritize which area you might want to tackle first? Or is it really that you're, kind of doing a lot of different areas in parallel, depending on, the different key stakeholders you might have in an organization?
Yeah, it's a great question. So the short answer is we always prioritize, or I believe we should always think about security first. The conversation has to start with security, because without security, you're not safe. The data is not safe. The facility's not safe, and therefore nothing else can happen after that. So you have to start with security. And when you think about security, it has to be an integral part of the decision making, influencing the choices, the planning stages, how implementation, the roadmap. So security has to be number one. After security, you can move into more of the tactical things like, okay, well, what hardware, software, networks need to be built? What needs to be updated? How do we standardize? What does the actual physical IT roadmap look like? And then really third has to be the change management component of it. So if you're going to do all these things, you have to make sure that people are trained, they understand, their workflow may change. Hopefully it improves, becomes more seamless, but there will be some change involved. And there's going to be a phased approach. I think one of the challenges with any of these things, particularly in the IT space, is everybody's demanding time to implement different technologies and often get siloed from department to department. So managing the expectations of the stakeholders and doing a nice phase rollout and communication is definitely a third and very big priority. Very often, I think health systems miss the opportunity to educate and properly launch some of these new solutions. And again, I would say, vendors don't do a great job also of helping that. And that's their responsibility to help drive that type of education at the healthcare system as well.
Yeah, and that certainly makes sense and ties into a point that you've made a couple of times, which is driving buy-in and driving engagement, which I think, as you were just saying, requires not just throwing a tool into place, but actually thinking through that process and getting the right people involved. And then, I think you also said, the education and training components around it, because whether we like it or not, some of the new technology is not necessarily intuitive when it first comes out. But
That's
once
right.
you actually get the curtain peeled back for you, then you understand how it's actually, how it can drive improvement and that the interaction can actually prove beneficial.
Absolutely.
So the other thing that that you first mentioned, which is music to my ears, is that security has to come first. So when you're thinking through security, I guess, kind of what are the layers that you're thinking about, and what are you considering as you're going through maybe a strategic analysis of how to ensure that security is built in and then evolves as the system changes?
Yeah, that's another good question. I think it goes back to, there's a few things that really stand out to me as we work with lots of clients, lots of different health systems across all the different care settings. There's generally, 5 to-dos, and it's multifaceted, right? So it requires a comprehensive approach. And I think that's important to say. So it's not just one thing, it's several things. But I think there are maybe 5 fundamental things that really stand out to me. And I also feel that once again, it's incumbent on the partners, the vendors, to be able to lay this out very simply and clearly for the health system, who's got a million different priorities, and at the end of the day, their core expertise and their responsibilities to the patient. And so we have to do a great job of educating. But there's 5 to-dos that I generally talk about and really stand out to me. The first one would be get help, right? I mean, these are all new, highly complex things. Cybersecurity, even the IT roadmap with all the different advances in technology, requires deep expertise. It's an ever-changing landscape, and it has to align with business objectives. So that's a lot. And so get help, right? Don't reinvent the wheel. Go find a partner or an advisor, somebody that's done this before, made all the different mistakes, and could kind of help you through the process. And start with a basic assessment, right? Start with a basic assessment and force this partner. I say force because a lot of times they're not proactive, but as let's say, if I was a hospital healthcare stakeholder, I would ask, prioritize things for me. Tell me exactly how you would do it, and try to take advantage of their experience and having done this, hopefully lots of times, and really force them to prioritize and force rank what they would do to try to make it. Now, I'm not suggesting that every health system is going to do it the same way, and very times the priorities are different, but really, insist your partner prioritizes things for you. So get help, find a partner, do an assessment. That's number one. Do the basics very well, right? Like good security starts with good IT hygiene. And so forget about all the fancy things, just do the basics well, train your teams, multi-factor authentication, just basic things, leaving your computer on, accessing things from home, going through firewalls, passwords, just the basics, right? Those basics are the primary ways that threat actors get in and start and breach security is through the basics we often find. The third is always to get, executive buy-in, but also this is why I say the first one was get an assessment, work with a partner, but you need to do an as is and share that with the executive team. Because often executive teams don't understand their level of risk. Even internally in Atomy, I always ask the team, well, what is our level of risk? If we're going to be providing IT cybersecurity solutions to healthcare, what is our level of risk? We're managing lots of endpoints for clients. So what does that look like? And so I think you have to provide the executives in a healthcare system that visibility to help them understand it. Maybe not at the very detailed level, but at least understand the level of risk to mobilize the amount of resources and funds they need, depending on where they are. The fourth thing is always, appoint someone to develop and focus on it. And so this is not a part-time job. Cybersecurity is complex. It ties into almost every decision, especially on the technology front, that a provider will make. And so you need somebody that is an internal champion, that this is their full-time job, and they're going to look very holistically at this and work with any potential partners or other types of technology partners that they have. And then lastly, I would say, perform regular risk assessments. Just like we do HR, regular employee satisfaction, customer satisfaction, we do tests on our internal infrastructure operations, do one for security, do a regular annual risk assessment, an SRA, identify where their vulnerabilities are, and constantly try to update your roadmap, because those things are going to change every year. And so I think it's very important those 5 to-dos are done or recognized very quickly.
Yeah, those are some kind of 5 really essential points to keep in mind. And for those of you just joining, I'm talking with Frank Forte from Anatomy IT, and we've been talking kind of about IT deployment and considerations for structure, and now starting to get into security. And Frank, with those 5 points that you kind of laid out, what have you seen be effective strategies to walk, the clients that you've worked through or other organizations that you've worked with to internalize and understand the complexity of each of those 5, and then at the same time not feel like it's overwhelming because there are so many different components and ongoing effort related to it?
Yeah, overwhelming is something that I think going in, the provider is going to feel overwhelmed, because in addition to all the operational things that they're dealing with and patient care things that they're dealing with, they're also dealing with, security requirements that are coming from, the payers, right? They're going to require getting cyber insurance is a huge hurdle. In some cases, a lot of providers aren't even eligible for cyber insurance. And so getting ready to attest to that is a really big task for the providers. And then prioritizing all the different components of it, what has to be done first and second and third. And then the funding part of it is also a big piece of it. How much should they spend? What's going to get them to a certain level of security? What's the return on investment of that? How much do you really need to do? And generally, when we're talking to clients, I think the takeaway here is be proactive. Do 50% more than you were doing yesterday. Just start there. Okay. We generally like to start with an assessment. And so just let's know where you are. Okay. And start to understand where are the weak points. Where have you made progress? What type of internal resources do you have? Is the issue around your hardware and tool sets that you have? Or do you have other things that are coming into play that we have to be concerned about? Do you have a disaster recovery program? Because things often at some point, you'll have issues at some point. It's not really if, it's when. And so will you be prepared for it and be able to bounce back in a short amount of time? So we look at all the basic things first, and we ask the clients to start with the basics, do 50% more than they were doing yesterday, just to get started. And then we start going through checklists with the clients. We do what they call a health IT framework, which is really a holistic assessment. And so you can't just really look at cybersecurity initiatives. You have to look at cyber IT and change management altogether. Because again, you could have the best technology, the best cybersecurity tools in place, but if they're not implemented, if the stakeholders aren't adopting it, and if it's not reinforced in your security policy, then it's not going to be sustaining. And so we do a full assessment, health IT framework assessment that gives a really holistic view up front. And then we just start prioritizing which things do we think are in most need, and figuring out ways to work with clients to help prioritize those things and fund those things. I think the funding is also, and it doesn't have to be terribly expensive. I think a good thoughtful plan and phased approach where you get to some milestone in a period of time is the right approach. Candidly, healthcare systems can't digest all these different initiatives at once anyway. So it's important to really lay out a phased approach and not, as you said, Matt, overwhelm the client or overwhelm the healthcare facility.
And kind of given that phased approach, and also your experience of working with a number of different facilities or organizations, are there certain findings or certain steps that you see kind of frequently rise to the top of the ones that should be considered first, or is it really unique in each circumstance?
Oh, it's a good question. I think it's unique in each circumstance, but the basics are never done enough. I think that's the first place to start, right? Just having, password protection and making sure your screensaver goes on when you leave. And if you're going to be accessing it from a remote device, make sure your IT system has provided a firewall and access through the firewall, which is protected and secure. Those are the things we always start with, because those are the things that, as basic as they are typically never done to the degree that they should be done. And a lot of that is just education, training, and candidly just, a consistent emphasis in communication internally, which again, why back to one of the points we talked about earlier around some of the 5 to-dos, one of them is that internal stakeholder. So it's not just about deploying new security technology or IT technology. It's also about communication and reinforcing why it's important. I mean, it takes a while for even within any company to get everybody aligned on what they have to do and do it consistently. So it's the basics, I would say, Matt, are the most important thing and where we always start. And then once we
makes sense, that the basics end up needing to be a focus, kind of given, in the infrequent settlements you hear, at least from the HIPAA perspective, that, kind of some of those key building blocks are missing. I guess if you had the ability to kind of implement some change, it sounds like maybe your 5 elements that you identified for earlier would be some of the ways to help avoid overlooking those basics and start baking those into the culture and the overall operations of an organization.
Absolutely. I think those five steps, at least we found at Anatomy, that those are pretty much universal. And if you tackle even 50% of those 5 steps, I mean, you made a lot of headway in getting your organization ready for, or in terms of getting them secure and becoming as compliant as possible. Nothing is going to prevent, the full risk of cyber attack, but you can do a lot to mitigate it. And certainly you can do a lot to be prepared. So when it does happen, you'll be prepared and you'll be able to minimize downtime and the cost. And what we always find is that, most healthcare organizations, and I understand why. So it's just the nature of all the things going on, but they function more reactively, right? And then what ends up happening is it's much more costly to remediate in the long run, as opposed to being able to anticipate what could possibly happen and be prepared for it. So when it does happen, you'll be able to quickly address it, minimize, if it's a data breach, minimize the amount of data that could possibly be leaked out, which is incredibly harmful and costly, and be able to minimize downtime and quickly get back to normal.
Yeah, in light of those potential consequences of that inevitable successful attack, do you feel that organizations are doing enough now to be proactively ready, or is it still kind of stuck in that reactive mode, despite the feels like almost daily announcement of a cyber attack that's caused a disruption?
Well, the short answer is no. And that's based upon the year-over-year increase in data breaches, especially in healthcare. I mean, that definitely validates that there's not enough attention and focus on cybersecurity. There's a lot of talk about it, but we're light on action as as an industry. So, I think, look, healthcare stakeholders, healthcare facilities know they need to protect themselves, but I think they're hampered by generally a lack of expertise, and it takes a lot of expertise. It's not just somebody that's dabbling in cybersecurity. It's about knowing what's worked, what hasn't worked, but also I go back to this prioritization. I think that's what happens. It's almost like, I'm trying to think of a good analogy, but you said it. You get overwhelmed. All these things, I need all these tools and I need all these services, and it's going to cost this and cost that, and no one can seem to quite tell you, well, what's the benefit of doing this, and how, and do I really need this, and to what degree, right? And I think there's enough data out there to make some pretty good assumptions on what needs to get done. And again, partners in this space need to be clear with healthcare providers on here's where you need to start. They need to be more demonstrative in laying out those priorities. Otherwise, what ends up happening is no action is taken. There's always this issue of like, well, do I really need to do this or not? You primarily find a lot of that, or particularly find a lot of that in some of the smaller facilities, or definitely on the independent physician practices. They don't believe they really need all this, and it's overkill. And candidly, it could be at times. It's not right sized for smaller healthcare providers. It could be incredibly expensive, but also incredibly disruptive for 3 or 4 physician practice. I mean, to go implement all that stuff is like a non-starter. And so I think, again, partners have to be realistic and provide a really good roadmap and prioritize with the provider that they're working with, and take into account a lot of other factors.
Yeah, no, taking that realistic approach, and it sounds like essentially take a deep breath and then look at the organization you're talking to figure out what that appropriate roadmap that you mentioned is, and that prioritization is certainly a great message. And unfortunately, it's going to have to be our parting message, because believe it or not, we're already out of time. I want to thank my guest, Frank Forte, for a great conversation today.
Thank you, Matt. I really enjoyed this. I hope this helps.
Yeah, and thank you to everyone listening. Keep the dialogue going and connect with me at #HCDEJURE. I'm Matt Fisher. Until next time.